Hello, classmates of Mr. Williams' third period. My name is Austin Williams, and my semester health project is about hemophilia. Hemophilia is a blood disorder where your blood clots, and so no scabs. And without scabs, you kind of just keep bleeding, and that's a big problem. It's pretty rare, so it's not as big as you'd think it'd be. So yeah, let's get started. Okay. How is hemophilia inherited? The gene responsible for the Christmas disease. Christmas disease is hemophilia. That's what it is. No blood clotting. Exactly. Christmas disease is carried on the X chromosome. Females have 2 X chromosomes, and males have 1 X and 1 Y chromosome. If a male inherits the faulty gene on his X chromosome, he could develop Christmas disease. If a female inherits the faulty gene on one of her X chromosomes, she will be a carrier for Christmas disease and may pass the defective gene onto her children. All daughters of a father who has the defective gene will be Christmas disease carriers. A father does not pass the faulty gene on to his sons. A mother who carries the faulty gene has a 50% chance of having a son with Christmas disease, and a 50% chance of having a daughter who is a carrier of the disease. Females are usually only carriers because they have 2 X chromosomes. If they inherit the faulty gene on the X chromosome, the other X chromosome produces sufficient factor IX for blood clotting. However, female carriers may produce less factor IX than women who are not carriers, which can result in mild abnormal bleeding after injury or surgically producers. A female can inherit Christmas disease if both of her parents pass the faulty gene on to her. Although it is rare for a female to have 2 parents with the faulty gene. What hemophilia does to your body? No blood clotting factor IX, which leads to prolonged or spontaneous bleeding. The less factor IX your body produces, the worse your symptoms are. Without treatment, Christmas disease can be fatal. A person is born with Christmas disease because although it may not be diagnosed until later in life, in about 2/3 of causes Christmas disease is inherited. The other 1/3 is caused by a spontaneous gene mutation that occurs for unknown reasons during fetal development. The disease is almost always exclusive to males. Sucks for you guys. There is no cure for Christmas disease. There are, however, treatments for the condition. Regular treatments is essential for managing the symptoms of Christmas disease. Factor IX injections. Christmas disease can be treated with factor IX injections to prevent or stop bleeding. The factor IX can be derived from donated human blood or made in a laboratory. Artificial factor IX is called recombination factor IX and is generally recommended over blood-derived factors because it is safer risk of contracting HIV and hepatitis from factor IX treatments is lower than ever due to improved blood screening practice. Wound treatments. If you are mild from Christmas disease, your doctor may give you a product called decompression active DDAVP to apply to small wounds to stop the bleeding. Larger wounds and internal bleeding require medical treatment from your doctor. Prevent treatments. If you have a serve from a Christmas disease, you may need preventive blood transfusions to avoid or reduce prolonged and heavy bleeding. If you receive blood diverted factor or blood transfusion, you should be vacated for hepatitis B. What types of tests can you take to see if you have the disease? If you are a woman with a family history of Christmas disease, you can undergo genetic testing to see if you carry the faulty gene. Genetic testing is more than 99% accurate for detecting the faulty gene, according to Barbara A. Conkey and her fellow researchers at Reported in Gene Reviews. Symptoms of hemophilia. Several cases of Christmas disease are usually diagnosed before parents in 1 year old. Mild causes may not be diagnosed until a child reaches his or her toddler years, or sometime even later. In all cases, diagnosis is usually happens after abnormal bleeding from an injury or surgery. Events that may lead your doctor to suspect Christmas disease include prolonged bleeding after surgical procedures or teeth extraction, prolonged bleeding from cuts or other wounds, unexplained excessive bruising, unexplained excessive and prolonged nosebleeds, unexplained blood in the urine or feces caused by internal bleeding in the gastrointestinal, or urinary tract. Internal bleeding that pools in your joints, causing pain and swelling. The following symptoms are usually only present in several cases of Christmas disease: unexplained bleeding in the skull after childbirth, spontaneous bleeding for no apparent reason. Complications with treatments. With treatments, you will most likely lead a normal life. There is a slight chance that you could die from excessive blood loss, experience bleeding in the brain, or have long-term joint problems from internal bleeding. In rare cases, the treatment of Christmas disease may result in abnormal thrombus or clot formation. Diagnosing Christmas disease. If you or your child shows symptoms of Christmas disease, a doctor may order blood tests to confirm the diagnosis, including factor IX tests to determine how much of the clotting factor is present in your blood, activated particle thromboblastine, I have no idea, time APTT test to detect how fast your blood clots. Another one is prothrombin time test, another test to determine how quickly your blood clots. Vibration test to gauge your body ability to create a clot. You guys know, okay. The first one's good. It goes first to best, and that's pretty good. And thank you for watching my semester project, even though you don't care that much, but okay, bye. The end. Even though I have about 10 seconds more until I reach 10 minutes, and I'd really like to go there. like right now. Okay, I nailed it. See you guys later.